In the last 4 years, thousands of patients have visited us at the Cupping Centre, which is annexed to the Alternative Medicine Clinic. People have come suffering from many diseases, such as migraine, headache, spondylitis, neck pains, bronchial asthma, skin allergies, and many other diseases, and we have tried to help them through cupping. In fact, many of the cases of allergies were eased, and the results of cupping on cases of migraine, neck pain, and bronchial asthma were very good. As for the patients of hypertension, commonly known as high blood pressure, who have to take medicines continuously, cupping is so successful that we have had to be careful that they don't take their medicines in the same doses after it. Their blood pressure should be measured twice or 3 times a day, and according to its readings, the dose of their medicines should be modified. This is because using the same old dosage may cause those patients complications by lowering their blood pressure too much. The medical term for this is orthostatic hypotension.
I developed diabetes. The symptoms were dizziness and xerostomia in the mornings. I went to a doctor who asked me to have laboratory tests carried out. When I gave him the test paper, he told me that I had the beginnings of diabetes. The analysis showed that the proportion of diabetes was at 320%, so he prescribed me some medicines. I took them, but I didn't get the results I had hoped for. Some friends advised me to go to another doctor in order to have cupping done, so I went there and underwent treatment under a trained practitioner and according to approved regulations. Thankfully, when I had my blood sugar levels tested after cupping, they were 110. They haven't exceeded this level since, and I haven't suffered from any of the previous symptoms anymore.
I suffered from numbness in 3 of the fingers of my right hand, caused through a clotting of the arteries. This caused further problems, so that when I poured cold water on my hands from the tap, for example, when I performed the ritual ablutions for prayer, my hands would swell, and I would not be able to move them at all. I was like this for a month and a half. Then I went to a doctor, who explained to me that I had numbness and anesthesia in 3 fingers of the right hand. I asked him about the cause of this numbness, and he told me that I had a clotting of the arteries of the right hand. I asked about possible treatments and cures, and the doctor prescribed some medicines for me, and told me, if your case improves by taking these medicines, then fine. Otherwise, I will perform a surgical operation on your hand. I took the medicines, but they didn't help at all. Then the season when cupping is practiced came around, so I had it done, and I was cured at once. My previous condition had rendered me unable to work. In fact, I had been unable to do any work for 1 full month. After cupping, however, thanks to God, I recovered and regained my energy and vitality, so I returned to work. Now, I am well and healthy by virtue of God. I myself, like many other doctors besides, have supervised many cases of infertility. The cause of male infertility is the number of the spermatozoa in the semen not exceeding 4 to 7 million. The reasons for this can be factors such as testitis or an insufficient perfusion of the testes. Cupping helped to increase the number in such cases. There have been numerous cases which we have documented on TV, and many others for which we have data, where patients have been able to conceive with their partners after undergoing cupping treatment. We can see that cupping helps to strengthen the immune system around the testes. and, as a consequence, it supports the nutrition of the testes.
I suffered from infertility for 12 years. I went to many doctors, made many laboratory tests, and took many medicines. The movement in the test semen was always 25%. I took medicines for a long time, without any results. During the 13th year, they advised me to have cupping done, which I had heard about before. I went and had it done. 1 month after cupping, my wife became pregnant, and God has granted us a baby girl. The ratio of the movement was 20% before cupping, but 1 year after the child's birth, it became 70%. Thanks be to God who has granted us this little child after we were patient for 12 or 13 years.
The cupping experts on the Syrian medical team have to comply by extremely strict medical and scientific regulations so that they perform cupping correctly and do the art justice. In this way, it has been established as both a valid and useful medical operation, just as it was legislated by our Prophet Muhammad, communication with Allah and peace be through him. If it is applied correctly, patients will enjoy benefits from their treatment, and they will be cured by God's leave, without any side effects at all. One of the most important conditions of this operation is sterilization and cleanliness. The skin of the patient should be sterilized around the site of cupping before and after treatment, and then the simple wounds should be dressed with sterile medical bandages. The medically sterile scalpels should be used only once, and every patient should have his own fresh medical lancet and his own 2 cups. These instruments should be destroyed after cupping.
I emphasize the subject of sterilization and that the cups, the gloves, and all other materials should be used only once. Then they should be destroyed. No cups or scalpel should be sterilized after use. Rather, they should be thrown away and exchanged for new ones for every patient. By doing this, we can avoid infection, infectious epidemic hepatitis, and other reactions of the skin at the site of cupping.
By observing these scientific conditions, it has been found that no damage results from applying cupping at all. In order to be able to apply cupping in the correct scientific way, you should be qualified scientifically and medically. You should also be well informed about the rules of cupping as regards its season and the site of its application on the body. You should be conversant with the conditions required before and after cupping, so as to advise your patient on how to follow them and prepare himself on the morning on which he is to undergo treatment. The equipment needed is glass cupping cups, known as air cups, any kind of antiseptic for the light incisions, except alcohol due to its flammability, a flame lamp to light the papers, medical scalpels perfectly sterilized, sterile cotton or gauze, and papers twisted in the shape of cones so as to enter easily through the aperture of the cup after being burned. On the morning of cupping, the patient takes off his upper clothes to be bare-backed and sits in a normal sitting position with erect back. The temperature in the cupping room should be neither hot nor cold. The doctor determines the site of the cups on the upper part of the back, which is most certainly the only place where cupping should be practiced. This region is situated between the two shoulder blades on both sides of the spinal column. The two cups are fixed in place symmetrically to each other on either side of the spinal column and directly above the heads of the two shoulder blades, so that the lower edges of the cups touch an imaginary horizontal line between the heads of the two shoulder blades, or no more than a centimetre above this line. After this, the skin should be well sterilised. Then the cupper burns a paper cone and puts it inside the first of the air cups. He sticks it on its specific site. Then he takes the second cup and sticks it in the same way on the site symmetric with that of the first cup. He should be sure that the two cups have been firmly fixed on the body, so that they tighten the skin well. If not, he must repeat the fixing of a weakly fixed cup again. He leaves the two cups in place for 3 minutes. Then he removes the first cup, empties it of the remainders of the burnt paper, and fixes it once again by burning another paper cone. Then he removes the second cup and refixes it again as quick as he can, in order to prevent the congested blood from flowing. This operation is repeated one more time in the same manner. Then, after a third time, the cupper makes light cuts at the site of the two cups with a sterile scalpel. On average, there should be 10 to 14 cuts on each side, and the cuts should not be more than 1 millimetre in depth and 5 millimetres long. Then the cups are applied again in the same way over the cut region, so that blood drainage begins. When the cup becomes reasonably full, it should be removed, then fixed again, until the amount of the drained blood in the two cups is about 150 to 200 cubic centimetres. If the patient is having cupping applied for the first time in his life, the blood is drained only twice after the cuts have been made. In subsequent years, the operation can be repeated 3 or 4 times in the same session. We can apply cupping twice a year, provided that the second time is in the following month. After removing the last cups, the site of the cups should be cleaned well with antiseptic and dressed with a piece of sterile medical gauze. When the cupping operation is finished, the cupped person should eat some vegetables, such as salad, an ideal Arabian salad dish being fattoush. This food is easily digested and assimilated. The body finds itself in a new state, so we should lighten the load for digestion during the first few hours after cupping, until the body has accustomed itself to this new state. The cupped person must not have milk or any of its derivatives until the next day after cupping.